Joining us now via Skype from Jos is the Executive Director, Women and Girl Child Rescue and Development Initiative, Bridget. Bridget, it's good to have you join me right now from Jos. Talk to us basically, how aware are those in the IDP camps, at least from your observation?
Good morning, Mike and Veronica. I hope you can hear me from here.
Yes, we can. Go ahead.
Okay, so it's a really trying time for the world when it comes to the issue of COVID-19 because it stands, a lot of people stand high risks of contracting it. And as we all know, that anybody can be vulnerable when it comes to the issue of coronavirus. It doesn't choose the learned or the illiterate or people who have homes or people who do not have homes. But most vulnerable are the persons in the internally displaced persons camps. Why I say so is because it is very hard for them to observe the simple techniques for prevention of the contraction of the disease, like the washing of hands, the social distancing, the coughing with the tissue or the elbow and all of that. We know that it's a crowded place for them. And so observation of the social distancing is going to be a little bit of a challenge to them, as already is a crowd in one place. And we also know that there are people who come to visit them, for aid and all of that. And they also go out to markets and look for something for survival. So any of them can as well come in with it. And because they do not have the media amenities to be able to watch. Like for me at home, I can watch on TV when there are jingles and messages coming in for how people can prevent themselves from contracting this virus, COVID-19. But they are there without TVs, without radios. Some of them use their phones really, and the information is not really in circulation for them to use. So people, they can just do with the people say, or the awareness by maybe people like us who are on the field sending awareness daily to them. For me, I also see on social media, I also see on TV updates about how many cases so far in Nigeria and the world over. But they do not have these privileges, to watch and see and also observe or monitor the cases of COVID-19, whether it's rising, whether it's declining, or if people are dying of it, or people are getting healed by it.
All right, if I may just interrupt your thoughts, Bridget, talk to us. Obviously, from what you are saying, the major issue now that the government can focus on is to ensure that COVID-19 does not get anywhere near IDP camps. What would you expect the government to put in place to address that at this point?
At this point, first and foremost, the persons in the displaced persons camp, they need enlightenment and awareness continuously. They need enlightenment, they need awareness, they need to know what COVID-19 is all about. So the government can set doctors in place to go in there to really explain to these people what it takes to contract the virus. They can go in there to explain to people what the virus really is. First, that's what the government needs to do. Secondly, the government have to make water available for these persons in the IDP camps. If they need to constantly wash their hands, then they need water. They need supply of water, constant supply of water to continue to do that. They need sanitizers. You know that when you donate sanitizers to these people, they use it all the time. And so they will need sanitizers constantly as far as COVID-19 is concerned, and they need to prevent it. So the government needs to do something to these people. I and you are in our homes. We are not asking the government to give us soap. We are not asking the government to give us water, because we are trying on our own to have access to water in our homes. Apart from those who have water from the pipe borne, there are those who have made provisions of water through the borehole and all of that. So we are more privileged compared to the persons in the IDP camps. So we can wash our hands, we can use our sanitizers, but they don't even know about it.
All right.
So the government
Bridget,
needs to make water available, and the government also needs to find a way to ensure that there is distance among these people if they can.
All right,
observe.
thank you very much, Bridget. We have to leave you here now. Bridget DAKYES, thank you for talking to us on TVC Breakfast.
Joining us via Skype from Jos is the Executive Director, Women and Girl Child Rescue and Development Initiative, Bridget DAKYES. Thank you for joining us, Bridget. Now, some have said that the government alone may not be able to do this. What are persons like you who have NGOs running across the states that have these camps doing, or what can you do to work with the government and ensure that precautionary measures are taken?
Thank you, Veronica. Actually, government alone cannot do this, and that is why we need a collaboration. Now, government should collaborate with civil society organizations to make sure we reach out to the persons in the displaced camps, or to the persons, to the displaced persons in those camps. Yeah, because they cannot also do it themselves. Remember that there is already an issue of poor availability of water in those IDP camps, and because individuals like me and many others who are on the ground working with IDP camps cannot do it alone. We need to collaborate. First and foremost, they need to have adequate supply of water in order for them to continue to sanitize and keep clean environment. And then the government should be able to provide, so to speak, the jacket needed for them to put on, the face masks needed for them to put on in order for them to be able to provide to protect themselves. We're talking about social distancing. We know that already is a crowd there. And I do not understand how these people can prevent the contracting the virus with such a crowd that are found in the IDP camp. So I also, we suggest that the government and people like us should be able to collaborate to find a solution. I think that screening should be made for any person who is planning to take aid to people in the IDP camps. Even myself and many others who are planning right now, plans are ongoing for us to be able to go out there to give our support to persons in the displaced persons camps. But again, we're talking about providing sanitizers and a means for them to be able to keep washing their hands per minute. But because we have a major challenge with availability of water, and of course, persons like me might not be able to have the means to be able to provide water, adequate water to persons in the displaced persons camp, as you know, because it's a very big project and that has to come from a bigger source. So but we are already collaborating to see how we can do that. Persons who are going there should be adequately screened, which we are trying to see how we can make provisions, and we can also collaborate with medical doctors to see how people can be screened before they come into the IDP camps. If there is any solution, if the government can provide a very big screen where people can see all of those messages about prevention, that will also be nice so that they know what it takes.
All right, Bridget, we have to leave you here now. Thank you very much, Bridget, for your time on the show.